Hello and welcome back. Thank you for joining us for another edition of a Bloom Talk for 2021. I am here with Lisa Jewell from Jewell Chiropractic, and we are going to be talking about all kinds of ways that you can prep your body and take care of your body after birth. So, would you mind just telling us a little bit about who you are and what you do before we get started?
Yes, absolutely. Thank you. My name is Dr. Lisa. I own Jewell Chiropractic, and we are a chiropractic clinic in North Portland. But I say we're kind of weird chiropractors because we do a lot of physical therapy, a lot of rehab, a lot of body work. We're more of a boutique experience for chiropractic care. So we have 3 doctors and massage therapists in our new office, and we're all specialized in core and pelvic floor training for pregnancy and postpartum. And then obviously with all the chiropractic, getting the adjustments, getting the body work, doing strengthening and rehab, and our appointment times are a little bit longer to accommodate that. So it's not your kind of 5-minute in and out. We really like to spend time with our patients, and we're trying to really create a sense of community for moms, especially during this craziness that we're in. I had my first baby last year, early pandemic, and so I know exactly how it feels to not have all those things you thought you were going to have postpartum, and
Yeah, it
be in a
definitely
place
looks
to still get
different.
them.
Yeah,
Totally.
absolutely. So that's really your specialty then at the clinic in general, or yours specifically?
Yeah, that's our whole clinic. So
The whole
we're
clinic. Okay.
95%, perinatal women's health period. We have the occasional dad, and we do see quite a few newborns that come in with mom postpartum, but that's kind of our niche market. And of course, we have moms that are still with us years later that are still seeing us and not necessarily brand new, but and all of our doctors have really similar training, which is nice. You can kind of go around and see whoever is available and fits your schedule. You're going to get a really similar treatment with everybody.
It's amazing. It's such a great resource for moms in the area to have specialized care like that. So let's get into a little bit. We talked a little bit beforehand about some of the things that you think expecting or postpartum moms should know about. So one of the things that you talked to me about was just how to prepare for birth, I suppose, right? Just prepare in pregnancy and birth. What do you want to share about that?
Yeah, I think doing prep work is so beneficial, and that's the time we're really excited, and we have a lot of energy to put into that. So making sure we're not just planning for the one day of the birth, right? We are planning for labor, we're planning for postpartum. So we talk a lot about how to strengthen and utilize your core during pregnancy as the baby's growing. That change really shifts your center of gravity. It can cause more aches and pains. And so how can we just use our bodies more functionally during pregnancy to strengthen us for the birth and postpartum? And then pelvic floor is, I know it's like a really buzzword right now that more people are talking about, which is fantastic, but really working on not just having a strong pelvic floor, but for birth, we want a really soft pelvic floor. My thing I always say to my moms is we don't want baby trying to come through this really tight, taut pelvic floor. We want a nice, stretchy, soft pelvic floor. So working and practicing that is something we talk about a lot, especially in that 3rd trimester as delivery is approaching, and giving you things you can be doing at home, alone or with a partner. I just think the more you do it, the more muscle memory you build up, the easier and less stressful it's going to be on the day when you're obviously not able to focus 100% on your body.
Yeah, that's interesting. I have 4 kids and I've never heard, you're right. Everybody always says strengthen your pelvic floor, strengthen your pelvic floor. And it's the first time anybody's ever phrased it the way you just did.
Yeah.
Shows what a gap there is, I guess, and what we're telling
honestly,
expecting moms.
Way more women have tight pelvic floors now because we're sitting, we're sedentary more, or moms who do a lot of running, CrossFit, strength training, things can be overly tight, which is just as much of a problem as something that's really weak, in my opinion. So yeah, it's definitely just so people know about that is huge.
So what are some of the ways that they can prepare their core strength during pregnancy, or get the pelvic floor ready? What are some of the specific ways that they can do that?
Yeah, my biggest thing I work with moms on is bowel movement practice. because pushing a bowel movement out and pushing a baby out, functionally very similar. And so we talk a lot about breath. We talk a lot about intra-abdominal pressure. I think the biggest thing that I see is hospitals and staff telling moms to take a deep breath and hold it and like bear down. And I don't know if you've heard of like purple pushing, or moms who have given birth who have like blown a vein in their eye from just pushing so hard. Like that shouldn't be happening, right? We should be pushing more functionally. We should be using our breath and our body, not fighting against it to help get baby delivered. So, it's a lot of breath work. It's a lot of muscle memory training. So bowel movement practice is a big one. And then just the way we're moving in life. I say we don't need to set aside 45 minutes a day to exercise. Let's just, every time we get up off a chair, let's do it this way. And we're going to do a mini squat. We're going to strengthen our glutes instead of going to, we don't have time every day to do a 45-minute workout. Let's just work this into our day and see how that works. Pairing little things like that with activities. Brushing our teeth is something we hopefully do every day. Okay, let's sit there and do a little set of pelvic floor lifts while we brush our teeth every night. Great, done. Don't have to set aside time for that. So it's really just about working functional movement in.
I think that's really appealing to expecting mothers, especially, to try kind of work it in your everyday life instead of having to do one more thing. That's like put aside that time, giving I don't know, little windows throughout the day where you can work it in instead. That's nice.
Yeah, I mean, I love physical therapy. I love physical therapists, but sometimes their expectations are a little unrealistic.
Well, and it's hard. It's just another. It's a lot. I mean, just you only have so much time, so it can be hard. Yeah.
So yeah.
Okay, we one of my questions was going to be about the pelvic floor, which we already kind of covered a little bit. Was there anything else that you wanted to add about that?
Yeah, I mean, I think for women to know that like doing this prep work and perineal stretching and doing the body work and having the pelvis really aligned, we do have some research that shows that all helps improve or shorten your labor times, helps prevent stalled labor, and reduces your pushing time, which to me, that all entails reducing your risk of tearing, right? So those are pretty big deals to be working on. And so, with all of that, we do the internal work so we can actually show moms what it should feel like and how they can do it at home or how their partner can do it at home. That's my general.
Okay, so a completely different topic was something that we discussed was the Webster Technique, which I've heard about kind of peripherally, but I'm really curious about it, and just share with us what you know.
Yes, absolutely. Yeah, we're all certified in the Webster Technique. It is a really great, gentle treatment. Obviously, during pregnancy, we're not doing big, poppy, cracky adjustments. I have my little flexi pelvis here because I love showing this.
Yes.
So during pregnancy, the pelvis starts to do this, right? Which is great for getting a baby out of our pelvis. But this makes us pretty unstable. And so the Webster Technique is all about balancing the structures of the pelvis. This pubic symphysis joint, as it's opening, it can sometimes get shifted or jammed like this, which doesn't feel good. And look what that does to our inlet. Makes it a little bit smaller. So by balancing the pubic bone on the front and these SI joints on the back, as well as all the soft tissue structures that attach to it. So we're talking like glutes, ligaments that anchor the tailbone, because we want for birth the pelvis to be able to open at the inlet. The baby's head can get through that first phase, and then to open at the outlet. And the tailbone does this really great flare. So like, look how much more space is created just on the bony pelvis with that. But imagine if things were really tight and stuck, like it's pretty hard for that pelvis to open up in the right way. And that's when women are pushing for hours. That's when labor stalls, is when there isn't that nice, flexibility and opening the way things are supposed to progress. So the Webster Technique is, it is adjusting, but it's a gentler style of adjusting those joints. And then it's working on those specific ligaments and muscles that kind of anchor the uterus to the pelvis so that everything can function as it should on the day.
So is it like a one time, or do you come a few times, or is it coupled with exercises at home? How does it work?
Yeah, I mean, like everything, the more we do it, the better outcomes we have. Same with like acupuncture and rehab. The sooner we start it and the more we do it, the better it's going to be. But I definitely still have women coming in right at the end, and we just do a couple sessions. symptoms. But ideally, I like to say like follow your prenatal visits, right? So like beginning of pregnancy, you're like monthly.
Yeah.
Then you kind of go to every other week. And then right at the end, we're doing weekly because your body, everything is softening and opening. And because it's more unstable, things don't hold as well. So definitely, 20 weeks is a great time to start. If you're having pain, obviously come in before that. If you're feeling really great and you're moving, then 30 weeks. But I think that's 20 to 30 weeks is a really good time. And it doesn't have to be super often that early. But we'll kind of ramp up to that towards the end. And then, at home to kind of pair with the Webster technique, that is something that the provider would do. But I talk a lot about spinning babies, smile circuit, all the things you can be in at home to help balance baby. And those are all really important with helping to make sure babies head down as well and head down in the right position. Because we would also love to avoid any back labor. Again, having
Yes.
baby be helped out. Yeah. So there's so much we can do at home.
Okay, so we've talked a lot about sort of the prep side, but let's talk a little bit about after you've had the baby.
Yeah.
And you mentioned the importance of rest, which is challenging. So what can you share with us about that?
Yes, and our culture makes it really challenging as well, right? Some cultures, this is like a given, and they won't even have to talk about it.
Yeah.
But I think for us, it's not necessary, and it is a privilege, right? Some people don't have the support they need, but I really like to follow like the first 40 days, the line-in method, which is the first 2 weeks in bed, first 4 weeks in your house, the first 6 weeks in your block, right? So that is allowing our uterus to kind of come back down to its normal size. It's keeping that weight-bearing gravity off of our pelvic floor while it's healing, right? It's just been through a pretty traumatic event. And if you've had a C-section, even more so, right? Your wound is healing and you don't have the support and strength in your musculature to support all of those pelvic organs. And so being off your feet, being not weight-bearing is what's going to give you the best chance of healing the fastest. And then just big things I tell women to look for if they're really chomping at the bit to it can be a mental health thing. It can just be needing some time alone. Like, of course, if you need to go outside and take a walk, great, go do that. But listen to your body. Right? If you're having low back pain 20 minutes into your walk, or you're noticing a huge intake or uptick of bleeding after you do a certain activity, like that's your body telling you that was too much too soon. If you're feeling great and you're going for a nice slow walk, great, then your body's ready for that. So that's my hardest part. We have very little research to support postpartum rest and healing, but there is some really good stuff coming out of like the UK and Ireland actually, that we now actually have our first set of guidelines. And really the return to high impact exercise is really recommended at 12 weeks.
Oh, wow. Okay.
Right. And it's, we get that 6-week check mark and then we're good to go. And I think even knowing to taper back into exercise, right? Even if you're 6 months postpartum, you're not just going to go for a 2-mile run right off the bat. No.
Yeah.
We're going to do some core stabilizing. We're going to do some body weight. Then we're going to work up to more high impact. So when you think about it that way, it's not that you can't do things. It's just like we need to have this progressive strengthening protocol to get back into normal.
I was just thinking about that the information you were saying was coming from abroad, and thinking also about just returning to work. And a lot of work is physical. I mean, if you were able to take the time, and then a lot of work is physical, and we don't necessarily count that as that
right
movement piece as well. And you don't necessarily have the ability to be gradually returning to physical work. And so that's another component of it that just sort of struck me when you said that.
Yeah. And I mean, an exciting and scary statistic we have is, I think it came out from Diane Lee. Don't quote me on that, but there's a study on that if doing postpartum pelvic floor rehab reduces your risk of prolapse postmenopausal by up to 70%, which is huge.
You mean working now on that?
Yes.
I don't even want to calculate the years later.
Yes.
They've been able to make that connection.
Yes. We've just started getting that data. So super interesting. And And it just makes sense, right? I mean,
Of course it does.
our pelvic floor has been working for 70 years, and if it fatigues out earlier in some people than others, what does that do to you? Yeah.
Yeah. Wow, that's
Yeah.
fascinating. Right.
Hmm.
Um, okay, the next thing I was going to ask about was about exercise. So we sort of covered that. Was there anything else about returning to exercise that you wanted to add in there?
Yeah, I mean, I just really encourage moms to do something that's really prenatal focused, right? Like, don't go back to what you were doing before pregnancy right off the bat. There's a lot of amazing like online options. Here locally, there's a ton of yoga studios and movement studios that have it. Here we do kind of a 6-week progressive rehab. I've dubbed it Mom Core, and so the first few weeks we're really just reconnecting with the core and pelvic floor muscles. We're learning how to engage them correctly. We're doing really basic exercises that look like you're not doing much, but are actually really hard. And then when you can do those, we move you up to more like rehab-based exercises, like quadruped on your hands and knees, bird dogs, bridges, things like that. And then we taper you back into running, biking, whatever it is that you enjoy doing. So I just think finding something that feels good to you, that finding a way to make it, again, fit into your day. It doesn't have to be 30 minutes set aside for it. Like we go to the park and I'm pushing on the swing and I do a squat in between every push. Great, just got a little mini workout in right there.
Right.
So I think just also having people to talk about that with and like troubleshoot with is huge, which is part of that community.
And having the vocabulary to do it too, since it is sort of unfamiliar territory to a lot of new moms.
Right.
We don't
Yeah.
exactly talk about it in the same way we do about, I'm training for a 5K or something.
No, which we should though. That should just be normal. Yeah.
Absolutely. Yes. No, I couldn't agree more. Yeah. So I also really wish I had known about your sort of, what was it? Your Mom Core program. I love that concept. I just think, I wish I'd known that was available to me at the time that I just had my last kid.
It's never too late to do it. I had a mom
true.
with a 12-year-old come in.
That's true. That's
Yeah,
true. We kind of think of it as being a
really short.
My watch just talked to me again. That's the second time my watch has spoken up during one of these. Yeah, we kind of tend to think of it as being restricted to this window, but that's not the case either.
No.
Yeah.
And I think breastfeeding too is another big time, right? If you are breastfeeding for 1-2+ years, like that impacts your body's recovery and it impacts your mobility, your stability. And so that should also be taken into account, which nobody talks about.
No.
Breastfeeding after the first few months, they're like, oh no, you're not postpartum anymore. But no, you are.
Absolutely. Yeah. So there's so many bits of wisdom in just that limited time that we've been talking, but I know you have so many more to share. So where can people find you? How do they go about making an appointment with you or one of the other providers? Tell us how that's done.
Yeah, absolutely. Everything's done online. So jewellchiropractic.com. You can schedule right online or you can call into our office, or all of our contact info is there. And like I said, we just moved to North Portland. So we are local and open Monday through Saturday.
Awesome. Well, thank you so much for coming in, sharing all you know. I'm sure you've been so helpful to so many new moms, with many more to be helped by all that you do in the future. So thanks so much.
Thank you so much.